here, it's our enforcement guidelines for medical establishments who don't have a state license. So what's going on is we passed a suite of bills earlier this summer. As John said, it kind of creates a pathway. Those who were open before January 2013, as long as you comply with our guidelines here, you'll be able to continue operating until July. We ask that you get into the LCB process when that application process opens. We're starting it here. They might have applications open as early as October for that. As long as you're in that process, you'll be allowed to continue operating. But if you get rejected or your application is denied, that's when we would ask you to wrap up your operations. So that's what's going on, and these guidelines help, and kind of here to just mainly answer questions, because I know there's a lot of concern about the upcoming stuff. The other aspect of it is we are asking a number of folks to close, those who opened after this January 1, 2013. And we've been in contact with folks, sent letters, had site visits, face-to-face conversations over the last 6 weeks, and we've asked folks to close by September 15th. If folks don't close, they can face civil citations and criminal actions that would be, there might be charges filed, but they could be removed, dropped if they just commit to closing their operations. And so I didn't have a lot of comments prepared. I just kind of wanted to provide this information to folks and answer questions. And so if you guys have questions, and
So,
yes, sir.
So now that if they have them out as early as October, I mean maybe November or whatever, what's the city's timeline looking at for the zoning?
Oh, right. So a new piece of legislation we're working on, and we're going to get started. It's reducing the buffer zones. The state bill that passed, 2136, allowed local jurisdictions to lower buffer zones for everything not be school or playground as low as 100 feet. And our proposal that we're going to start the actual official process with on Friday by publishing in an Environmental Protection Act requirements. I think we're going to be publishing this on Monday. We're proposing lowering that buffer zone to 250 feet.
Wow.
But then requiring a 500-foot retail dispersion. So stores aren't across the street and kind of clumped together that way. And so that process, it's about a 2-month process to get through that State Environmental Protection Act requirements. And hopefully it'll be right in time for December for going in front of City Council and hopefully getting voted out by City Council in December. So that's a little hard if applications are going out in October, though. What we're going to be actually having, myself and the team of city staff who works on marijuana issues, will be meeting monthly with the LCB over the next 6 months or so. And this is one of our questions we want to have with them. We're going to request they not reject applications based off violating the 1,000-foot rule as long as they think they're within the 250 that we're proposing. And I think a good way to prove that both to the city and the LCB is to have certified surveyors do those measurements for you so you can prove that in your application.
So this 250 feet that you're proposing, that also includes schools and
No.
Oh, okay. So we're still staying the federal
or public playground.
Okay.
Sticking to the federal.
So
right.
the federal 1,000-foot will still apply.
Right.
Okay.
And maybe this is just obvious if I had time, but like when you're talking about cannabis establishment, this is the retail producers, processors, everything.
So our first level of priority right now is the retail locations because the lack of clarity from the LCB if they're going to expand licensing for producers and processors, kind of low tier. There's guidelines in there for folks to follow. So basically what we're asking for is retailers to work with the producers and processors about labeling and testing a product. Okay. Figure out how to work that relationship, but ultimately we're holding the retailers responsible.
But I mean like this, like these enforcement guidelines,
those have only been sent to retail establishments so far.
Oh, okay.
Yes.
Any chance that the city will take up common path of travel or threshold to threshold?
We're going to mirror what the LCB measurements are, and so we're going to stick with the radius measurement right now.
David, have you heard anything from the LCB about the merit-based system to basically allow MMJs a priority in the license application? Because I'm hearing other things that there's going to be no lottery, there's no merit base, it's just going to open wide up for
It's
any
required by
retail.
state law for it to be a merit-based application. They have to take into account your experience in medical marijuana as part of that, as well as if you pay taxes and your permits and those kind of things. And so the first tier priority is experience plus being in the retail lottery. That was there in 2014. And second tier is just experience. And so what they're saying is those two tiers, they believe, will take up all the space, and they don't think they'll get to like the third tier folks at all. And the merit-based, they're kind of keeping an open mind from the conversations I've had is let's get the applications in and then see how many qualify under this merit-based process before setting a total number of stores prior to that process, which is interesting. So a lot of folks, if you keep in good graces on everything, it seems like you have a good shot of keeping your retail store open. Yeah.
What would the city like to see as far as number of retail establishments, number of potential producer processors inside the city limits? Is there talk of that? Have you discussed that?
We're kind of at, wherever the LCB lands. We are giving about 50 retail establishments an opportunity to stay open until July. I think we'd be comfortable with folks who meet all our requirements over the next 6 months and don't repeatedly violate the things we're asking. We would not object to licensing. So if LCB licensed all those, I think we'd be fine with it. That'd be a total of over 70 stores, and I'm not sure that they're going to go that high. I'm guessing they would probably go 2 to 3 times what we have at 21, so probably around 50 to 60 at the high end. That's just my guess. Sir.
Do you know how many at this point the city of Seattle medical places are likely to stay open?
I don't have the exact count. It's around 50 though. It's a little higher than 45 with initial count, but I'm not sure how much higher than that.
So the initial list of, well, it's 102 and then it was 98.
And then
so
it went up to 103. It's
right.
People open and close a lot.
Okay.
We've actually heard that 12 folks already have closed prior to our deadline. So
They didn't want to pay their September rent.
probably.
I'm not joking.
Yes.
Are you anticipating that when you say retailers that they're going to offer or be able to offer both recreational and medical eventually?
Yeah. So the state, the fully integrated state law would allow these medical establishments to get a retail license for recreational, but there's being created a medical endorsement, and that's a combination of Department of Health and LCB working on what that means, and then you can also apply for that. Now, what I've heard, and I'm a little confused if it's the store endorsement to sell medical or the consultant license that's being also developed, that there might be a limit on that, and I hope that's not the case. I hope there should be anyone who wants one, any of your employees or any of the stores who want this can get that, and that's what we'll be advocating for in Olympia. Yeah, with the agencies down there.
Can you expand on your potential 2016 legislative agenda?
Sure, we're still in the process of setting that. Last year, we advocated for a legal form of delivery, and we'll continue with that. I have not been able to speak to the mayor yet on other aspects. One is cannabis lounges. I know City Attorney Holmes is very much in support of that, and I think there's a lot of common sense in allowing legal form of cannabis lounges, but I just haven't had the time to talk to the mayor. There's lots of issues we work on, and this has not been one that's come up to the top yet, but I plan to very soon.
Well, then zero, and specifically, the city is aware of zero?
Yeah, I've actually met with the owners of Zero. I think it's a good model, but the way the state of the law is
It's a felon.
yeah.
So, is the city, because the county's not going to, the county's unlikely to enforce on that politically.
Right.
unless asked by the city. And if zero is allowed to stay open, and there's not a position taken about the lounges by the city, you're gonna see 100 lounges next year.
You mean in violation of the law as it stands?
In violation of law as stands, because you tolerate one without a tolerance policy.
So Zero's not open to my knowledge.
Yeah.
Right.
Oh, okay.
Yeah. I hope it
Narc.
continues to be. We have, you know, if we're confronted with an explosion of how this happens, we'll have to deal with that as it develops. We're upset about the creation of a new felony for marijuana consumption. We feel it's ridiculous. So we don't want to be imposing that, but we can't authorize these kind of things, and so it's going to be an enforcement question for us. And if that starts to develop, we'll have to look at that.
So do you want to talk a little bit about what enforcement's going to look like? Because it's going to start here on the 16th?
15th, we've asked people to close, and so on the 16th, if you're an establishment that we've asked to close and you're still open, there's a range of things that can happen. You can receive a citation for operating without a new Title VI regulatory license. It's about $1,000. You can also face a criminal charge if you come back again for that, and considering confiscation of marijuana as well. That would unfortunately have to come with a criminal charge, but if you come to agreement that you're willing to close, that criminal charge would be dropped. So we do not want to file criminal charges against folks, but it is our only kind of tool that we have to get folks to close sometimes. So
So it sounds like from what King County said, they're trying to take a civil route, and you all are, and the city of Seattle is kind of giving notice, giving you a ticket, and then we'll go the criminal charges route.
that's the only way we could actually seize product. And so even, I don't know what they mean by civil at all at the King County level.
I think they're saying that they're filing lawsuits against, that they were given cease and desist notices, and then lawsuits would be filed if people didn't close by a certain date, civil law.
I don't know what their legal strategy is, so I don't know what they're basing that on. But our own limitations on how we can kind of pressure someone to close, does require that a potential criminal charge after we take some civil action in order to seize product. But those would be dropped if there's an agreement to close the store. Yeah.
Public consumption policy wise, have you been watching what the city of Denver has been doing in Colorado, talking with local stakeholders, bars and establishments that allow smoking in an area in accordance with the CAS? Is that something that you're surveying, watching it as that does develop?
Not closely, but there is actually, we just found out earlier this week, City of Denver is hosting a conference, and a bunch of us will be going to that, and so we'll find some details from that. I know there's a citywide initiative.
That's where they came to the compromise. Actually, it went forward.
That got
and then-
dropped.
That's right. Now the city is going into meetings with stakeholders,
Right.
bar owners and whatnot around the city to find that.
So their law, my understanding, is flexible that way. They don't have a felony for allowing public consumption. And so even a bar saying you can do that over there can be considered a felony by allowing the use of marijuana on your premises. And no bar in Washington would do that because the LCB has taken strong stance about that as well. But even non-LCB licensed, like coffee shops or whatever, restaurants that allow that, could be considered, could get a felony charge filed against them. Not what we want to do, but we're limited in explicitly allowing certain things that way because of the creation of the felony.
So I've got two questions. So does the legislative agenda include trying to get rid of that felony?
Yes, it does.
And then the second one is, in the event that cannabis lounges were allowed, would they fall under the 250-foot and 500-foot buffer zones?
Probably, that would be a consequence of how the laws developed around that. I know for our purposes, we would want them to get the Title VI regulatory license as well. We defined marijuana businesses as cannabis lounges, so we could have that kind of oversight over folks. But with this, how it's structured at the state level, that's to be determined.
So, okay.
I'm guessing it would be at least 1,000 foot from schools and playgrounds. Maybe not the others, but I don't know.
Yeah, I guess I'm just wondering because it's my understanding that those kind of lounges, like right now, a bar or a tavern is under the LCB.
Yeah.
Because they serve alcohol. And would a cannabis lounge, if it's a vape lounge or something like that, be under local jurisdiction, or would it be under LCB considered 502?
So LCB has made clear they don't really want to be managing those. One of the things we're considering as part of the city attorney's idea on this might be to just ask for a local exemption, an opt-out from this criminal charge. I think it'd be a twofold ask. Reducing from felony maybe to misdemeanor for any jurisdiction that is not affirmatively opted out. So then it would come down to city council to vote this in as something they want, and then we would have local regulations on that. But that's just one of the potential strategies we might be using. So nothing confirmed.
And what about Title 19, the county, the Indoor Smoking Act for this countywide?
That's another battle you would have to do, because it's electronic vaping is banned indoors in King County. But I think there'll be a new advocate in King County Council to work on that issue after November.
But there's the old opposition.
Right, but there is the concern around vaping indoors is a little overblown, and I feel King County 4 or 5 years ago, without any science, just took this stance, which is unfortunate, problematic for us in other areas as well.
Yeah.
Yes, sir.
I have a question as far as enforcement. How is this going with what the voters voted for in 2003, lowering the priority for marijuana and cannabis?
So that is a restriction for the city attorney and the police, not for city civilian staff. So that's the lowest priority for police and the city attorney for filing criminal charges.
The city concerned the people of Seattle can go and in order to put people who are not compliant with the law that technically is illegal, you would threaten criminal charges. That's going against making marijuana and cannabis crimes the lowest priority.
So the lowest priority, the lowest priority only applies to the police and the city attorney, not our departments. So if the law wanted to apply to all city departments, could have done that, but it didn't.